You might be wondering how an operation on the bum, on the buttock, could actually lead to death. How do people commonly die from BBL surgery? The Brazilian butt lift, or, the butt enlargement surgery or procedure. There are two ways people commonly die from BBL. One is by anesthetic complications, and the second common way people die is fat embolism. I'll explain. BBL is obviously done under anesthesia, which means some medications are given to make the procedure painless. It could be done under spinal anesthesia, where the injection is injected into the back, into this space around the spinal cord and nerves. Or it could be done under general anesthesia, where the patient is put to sleep. If the patient reacts adversely to the medications that are administered, or there are other problems with securing the airway and the patient asphyxiates, then obviously the patient could die. The second way people could die from a BBL is due to fat embolism. What commonly happens in BBL is that fat or adipose tissue is harvested from other parts of the body. It could be from the tummy, it could be from the back, it could be from, the arms, the legs, depending on where there's excess fat. Adipose tissue could be harvested by liposuction and then transdeposited or injected into the buttock. If by mistake, inadvertently, that fat is injected into a blood vessel, a vein usually, and that fat could travel all the way through the blood vessels to the lungs, to the heart first of all, and then depending on how big the adipose tissue is, it could block the big blood vessels that will usually carry blood to the lungs for oxygenation, and then that could lead to death. That fat cell or adipose tissue could actually travel to the brain as well if the person has some shunts within their heart, what we call paradoxical embolism, and cause a stroke. So these are the ways people can commonly die: complications to anesthesia and fat embolism. Is it worth it doing BBL? It's quite controversial. So people will say yes, do it and feel confident with the size and shape of your bum. Some will say vanity surgeries are as described vain. If something could lead to your death, if the bum is not causing you any problems per se, apart from the cosmetic disenchantment the person might be having, if the buttock is not causing them any major problem, then why get it enlarged and stand the risk of dying in the process? Anyway, that's by the way. This video was actually meant for me to just talk about the two common ways people could die from a surgery on the buttock, BBL.